have been treating HIV-positive patients for over 20 years. So
yes, well, not treating them, observing them, looking at them.
okay.
For at least for people who are positive since 1980.
And what would you say to somebody who said the dissidents have not understood the problem with AIDS because they say that being HIV positive is not important, but it is important? Like this, there were a couple of people who stood up and said that at the conference this weekend. That the dissidents have killed people because they don't acknowledge that being HIV positive is significant in some way. But put that aside for the moment and just tell me, what's your experience treating HIV positive patients over the last 20 years? How is the best method to keep them alive?
My experience is that indeed HIV has nothing to do with the syndrome, because if I have a HIV positive patient, I'm always a bit afraid when he's A, homosexual, and B, admitting that he has used puppets. In that cases, these are the high-risk patients, and they run more or less into trouble with opportunistic infections and things like that. If a heterosexual person is HIV positive, in most cases nothing happens.
Really? You mean you just observe them? Okay, so how
even
many such
intravenous drug
patients?
abusers have low probability of getting of running into serious problems if they kept the drugs.
Really?
Yeah. But homosexuals who have had poppers
They might have
a much higher risk of getting sick.
Yeah.
More
And what
getting
about
cancer,
when
getting
they
immunosuppressive
do
things.
get really sick? When such patients get really sick, have you found that ARV treatments can pull them back and save them? Yeah.
Yes.
There's
In
a
some
point.
cases of pneumocystis pneumonia, for instance, if you do nothing, I'm afraid they would die. And if you give them in this situation antivirals or the also toxic pentamidine, then they recover. I've seen at least patients who recovered from
So
this
you use
pneumocystis
ARV
pneumonia.
treatments temporarily, like to pull somebody out of a crisis, and then you take them off them?
Yeah.
So they
When they recovered,
Yeah.
then we try to take off the antivirals again. In most cases, that's possible.
And you're allowed to do that as an MD in Germany. No
Yes,
one is
of
saying.
course you're allowed. You have to speak with your patients, of course.
Yeah.
They have to give informed consent. And you can do that.
Oh yeah, there's pension.
Wow.
But that should be in America the same.
It's not.
It's not? Well, the patient decides what kind of treatment he wants and how often. Not yet. The patient decides how often he wants to interrupt the treatment and whether he wants to have a treatment. It's not here in America?
No. No, here it's more, there's a standard of care, and if you don't go with the standard of care, you can be...
Who's running the HIV/AIDS ambulance? Yeah, with them I have some discussions. I had discussions in earlier time, and they know what has happened with the AZT drama. That's what they know. That's why they are careful with me, because if it comes heart to heart, we have to discuss also this. That we really killed a whole generation of AIDS patients when we didn't know what was going on with the AZT program. They know that, of course. That's why I think they don't touch me really.
Could you prove that AZT killed a generation of AIDS patients?
I think it could be easily proved if you discuss that.
There are the numbers.
Of course, a non-Aphrodite study.
Yeah. But did you see it personally, firsthand?
Yes,
You saw
I've
it.
seen it. I've met quite a lot of hemophiliacs. They tell me all the same story. They escaped the drama because they didn't take the AZT, and all their counterparts died.
Well, there are the numbers. There have been 2,000 deaths in Italy right the year after the introduction of AZT. We have published these. I mean, these are numbers from the Ministry of Health. It's not a secret. as soon as AZT was introduced, in the 2 years after introduction, 2,000 people died because of AZT, not because of AIDS. Because incidence remained the same, prevalence increased, but the number of deaths increased too. And I mean, this is easy to demonstrate. I mean, there's no problem. Everybody acknowledges this. This is given as a fact.
Yes, everybody acknowledges it.
Everybody acknowledges
But
it.
isn't it an unpaid for crime?
Huh? Well, yes and no, because when you introduce a new treatment, you don't know before what the consequences
So they could
will be.
conceivably be let off the hook.
Of course, but I mean, the orthodox scientists, they do not criticize this. I mean, they acknowledge that many people died because of too high
At the
dosage.
same time, they say that the denialists are killing hundreds of thousands.
Well,
millions of
that's
people,
different,
and
but
that's
you know,
isn't
these 2,000 people dead because of AZT are acknowledged, and they say, well, we didn't know about the side effects.
Antifungals are not without side effects as well.
They're also very powerful. Yeah.
Very toxic. So in the end, you don't know what is the better choice. To find out, you would have to control studies. You have to do again one arm giving them the antifungals, the old-fashioned antifungals,
Yeah.
and one arm giving them the IRVs for the ACE inhibitors to find out which are the less toxic treatment.
But now,
And you have to do it for a long time, because you have to find out what is the perspective of these patients, whether they just recover for 2 years or whether they have a good life expectancy. After you have to follow them for at least 10 or 20 years, of course.
This happens with cancer chemotherapy as well. You know, cancer chemotherapy of 20 years ago killed more people than cancer itself, and nowadays the cancer chemotherapy is different. But this happens with every kind of treatment. I mean,
but I disagree, because AZT, people died because they had an idea, a theory, unproven, where they said, you're gonna die from this virus fast.
in some countries, like in Switzerland, breast cancer, which is the most common form of cancer in mankind, is treated extremely more aggressively than in Italy. And you know, the two countries are in Switzerland. We have friends in Ticino, which is a few miles from Italy, and breast cancer is treated with an aggressive chemotherapy that in Italy is not treated because it is believed that the side effect of that chemotherapy will be worse than the cancer itself. And so, well, they have a combined chemotherapy plus radiation therapy after surgery. All those were fully operable.
But that's what we do in Germany.
In Italy, you only do surgery and then you evaluate. And in some cases, you use chemotherapy, in some cases, radiation therapy, and so on. So, but in Switzerland, they have a much more aggressive approach. And only 20 years from now, you will find out which approach, and in the meantime, people will be killed, if you want to use this verb, not because they had cancer, because the cancer had been removed. We are talking about women whose cancer had been removed. So this was just prevention of a disease that did not exist at that moment.
Right.
And so in Italy we have such protocols. In Switzerland, which is very close by, they have very different protocols. 20 years from now, we will know who will survive longer and who will die because of the cancer induced by the chemotherapy.
Do you think anybody should deal with consequences of the AZT deaths, or do you think we should let it go? I mean, is it par for the course in medicine?
I would say
or
that
is it an extreme case of
it
medical?
was an extreme case, but
It was a very extreme case because it cemented the wrong theory.
right. But at that time,
baked
It
into
put
the
the
theory.
theory in cement, because every people think that HIV is deadly virus because the treatment was deadly.
Yeah, that's right.
right. a woman who has operable breast cancer, in some countries is given preventive chemotherapy. That is, you are treating somebody who has no disease because the cancer has been eradicated, has been removed. So you're treating a healthy person with a very aggressive therapy whose side effects are very well known. And cancer itself is among the side effects because chemotherapy is mutagenic. You do this because you think that you reduce the risk that in the future this woman will develop a metastasis or a recurrence of the cancer. But you don't know for sure. 20 years from now, all the meta-analysis will tell us whether who was right. Those who treated healthy women with heavy dosage of chemotherapy, or those who didn't treat those women and just were waiting for the cancer to recur and treat the cancer when and if it recurred. This is extremely common, and 20 years from now you cannot sue anybody because both parties, they did what they thought it was right, and hopefully they did it in good faith.
What about those who say that Peter Duesberg, for example, is killing people with his theories that HIV does not cause AIDS? How do you answer that?
Well, that's completely different. This is like those who say that the Pope is killing people in Africa because he opposes distribution of condoms. I mean, everybody can say whatever he wants, but there's no scientific validity. I mean, many people say that the Pope is responsible for the death of millions of Africans or whoever else because he does not endorse the distribution of condoms. And, well, okay, I don't think that the Pope is upset because of this. He doesn't care at all. And,
so it's just really nonsense.
It's nonsense.
On the same side, he's responsible for a lot of births in Africa because he's against condoms.
Right. And you know, in Africa, the ones who could distribute condoms if they wished are only the religious organizations because they are the only organizations who are there. So if they don't distribute condoms, there are no condoms here.
In 1989, I did an article for Spin magazine about AZT, okay? This is at the peak of AZT. And I interviewed the head of St. Luke's Roosevelt Infectious Diseases, a doctor named coming to me. It's probably just as well that I can't remember his name because he doesn't want me to say his name. Anyway, I interviewed him and he said, okay, look, the truth is this. Those patients, I've stopped giving my patients AZT because I continue to see that those who are not given AZT live longer. Those who don't take AZT live longer. So I took that down and he said, now, you cannot quote me. And you cannot quote me, you cannot use my name. And I said, why not? And he said, because I have 4 children to put through college. They will destroy my career, I won't make any more money. And I said, but you're a doctor and you just told me what you observed to be true. So he said what they were doing at the time was the forces, the powers that be, they were checking the prescription pads. Any doctor who didn't prescribe AZT, I mean a lot of AZT during this era, would come under this kind of heat. And when you tried to say, can you explain exactly what, there wasn't a law in there. There was just heat, like in a dictatorship. Like, we're going to get you, your life is going to be a nightmare. It wasn't the same as saying the law says this, and it was outside the law. But they were very clear about how it was going to happen.
Since in here you do not have a public health system, you are forced to take the drugs. Unless you want to emigrate and go somewhere else. You are forced because once you don't take the drugs...
The drugs are much more expensive than any surgery.
Right. From what I remember when I was living in this country, if you don't adhere to what the doctor prescribes you, you can do that, but you are out of the system. Then next time the insurance will not cover you.
what came up in my Harper's article, the woman who was killed in Joyce Ann Hafford, she's also in Brent Leon's film. The subtext of that, it doesn't come up a lot, is, okay, why was she put on nevirapine, a drug that's banned in all Western countries? Because her doctor was recruiting patients for a clinical trial in Memphis. And this is an economic trap beneath the surface. I don't know if you have it in Europe, but we have it. And the doctors, believe it or not, get paid per head, like bounty. Every patient that goes into a trial, you get paid X amount if they're in the trial. Then you get more midway through the trial, and you get several times more if they finish the trial, if they complete the trial. So there's an incentive, which is terrible, an incentive for a doctor to keep to get a patient into a trial they might not belong in, and to keep them there to the bitter end. That's why they didn't take that woman off. Everyone's asking, they saw her liver was crashing.
Well, am I wrong, or in this country there has been the Tuskegee experiment?
Yeah.
So, why are you
imagine
surprised?
connecting money incentive for a doctor? Can
Well,
you
but I
even
think
imagine?
that
Let me just ask, could this
Tuskegee-
exist in Germany? Could this exist in Germany? Where you, Klaus,